the heart is a pump, but it's not just as simple as a pump. So if you need another heart, you need some hormonal supplement as well. The heart can interact with the body to help control blood pressure. Atrial natriuretic peptide helps the kidneys eliminate sodium so that water will passively follow and drop the blood pressure. So the heart not only is a pump, but it is also an hormonal structure. Our bodies work as a complete unit. Each part of the body is not independent from the other. So the reason I'm talking about this is a little bit deceptive to think that I can live this way or that and I can just get a transplant one day. Because even in that situation, taking anti-rejection drugs is rather difficult on the body as well. As blood leaves the heart, it leaves the heart through the aorta. And this piece right here is called the aortic arch. And there are 3 vessels that come off of the aortic arch. The first one off of the arch itself is the right brachiocephalic trunk, then the left common carotid, and then the left subclavian. Do remember that the heart serves itself. If someone says, what's the first branch off of the aorta, you would have to say a coronary artery, because the heart serves itself first. Can't take care of other people unless you take care of yourself, right? That's a good lesson to learn. Take care of yourself. When blood leaves the right brachiocephalic trunk, it goes a ways and then it splits into a right subclavian and then a right common carotid. It's a little bit difficult to see, but there's a branch up in the neck where there's an external branch and an internal branch. So there is an external carotid and an internal carotid. So external is probably going to go up the side of the head, and internal is going to go and supply the brain. Remember, it's part of the circle of Willis. We also learned earlier that the internal carotid continues as the middle cerebral artery, which in the brain case supplies the side of the head, the side of the cerebrum. We also learned that vertebral arteries go up through the transverse foramina in the cervical spine to merge to form the basilar artery. This is also another portion of the circle of Willis, the blood supply to the brain. Let's talk about what happens going down the arm. As the artery goes down the arm, it forms an axillary artery, brachial artery, radial, and ulnar going down the arm. Now, we also learned today that there's an exception to this information when we get the return back toward the heart through the venous system. Let's talk about the venous drainage from the arm for just a moment. There is a radial vein and there is an ulnar vein. There's the big clinical vein in the elbow area is the median cubital vein, and that's where nursing students, doctors may learn to take blood. That is a clinically important vein. Draining the outside of the arm is the cephalic vein, and then draining the medial aspect, from what I can see, is the basilic vein. And then there is a brachial vein that drains along with the basilic into the axillary vein, and then the cephalic drains kind of back into axillary to form subclavian. Look at your pictures to clarify that. But just the thing that I think I'm trying to get you to understand is an exception, or several exceptions to the rule. We don't talk about median cubital arteries, but we do talk about a median cubital vein. We talk about a cephalic vein and a basilic vein, and we don't name those in the artery system that I know of. So check that if you want to clarify. We like exceptions to the rule, and the reason we like those is because we think that's what our teachers will do on a test to check our knowledge. Remember that the azygos vein is what drains the posterior wall of the chest. We talk about the azygos vein, but not an azygos artery. And when I say we talk about this and not that, I'm saying that we have a named azygos vein, but we don't have a named azygos artery. That's what I'm trying to say, so let me be clear on that. As the aorta plunges down through the diaphragm, here's the muscular diaphragm, there is a branch that is called the celiac trunk. That's going to give branches to supply the stomach and the liver, and then next is the superior mesenteric artery, and then there are renal arteries, and then there's an inferior mesenteric artery. There is an exception to the rule in this. In the venous system, the inferior mesenteric and the superior mesenteric drain into an hepatic portal vein, which drains into the liver, which drains into hepatic veins, which drains into the inferior vena cava. There is not a direct connection of the inferior mesenteric and the superior mesenteric vein back to the inferior vena cava. It's through the hepatic portal vein, which goes to the liver, through hepatic veins back to the inferior vena cava. But notice, from the aorta, we have a superior and an inferior mesenteric artery serving the intestines. The clinical significance there is that what you and I eat gets routed to the liver for detox. It's a beautiful thing, actually. There are a few things that we eat or drink that don't have to go through that system, like when we drink water or alcohol, those can immediately absorb right through the stomach, and probably they're absorbing before then. Probably even in your mouth, some of this stuff is starting to absorb. So in the picture, you can the prominent blue is the renal vein draining the kidney. Here, this is the inferior vena cava. As the aorta plunges down through the abdomen, it bifurcates. There is a right and a left common iliac. Remember, your left is the right on the patient. Remember that. The right and left common iliac split in this model right about where the ureter crosses. There is an internal and there's an external continuation of the common iliac. So this is the external iliac, internal iliac. Internal would supply pelvic structures. External iliac continues until it hits the inguinal ligament, then it continues into the leg as the femoral artery. Femoral artery goes to the popliteal artery, then it splits into the anterior and posterior tibial artery. The anterior tibial artery is the one that has the dorsal pedis pulse. It's on the top of the foot. This is a common place to check for a pulse. Now, there are some exceptions to the rule. In the venous return back from the leg, the big named ones that we have to remember is that there's a small saphenous in the leg, and then there's a great saphenous. And we learned today in lab that the great saphenous vein is the longest vein in the body. Didn't we learn that? That is the junkyard for the parts to do bypasses in a heart bypass surgery. Maybe from one artery here over to an anterior descending over here. Autograft, that's kind of a nice thing. When your own body parts can be used to repair you, then your body will be very happy with that.